Hi, everybody. Welcome back to 10 Kids, 2 Docs. I'm Vivian.
And I'm Sylvia. Today we are going to talk about attention deficit hyperactivity disorder, more commonly known as ADHD, in the preschool, early elementary age group.
Sounds good. Let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
Okay, so I'm just going to briefly outline some of the defining characteristics of ADHD, just so everybody is on board with what exactly this is. So there are usually 3 areas where children are struggling when they have ADHD, and one of them is they have trouble sustaining their attention. Secondly, they have trouble curbing their activity level. They're just very active. And thirdly, they act on their impulses. They have trouble inhibiting their impulses. And in order for this to truly be a diagnosis and a problem, these characteristics have to be present for a while. They can't just be once in a while my kid acts like they have ADHD. They have these symptoms for at least 6 months, and then it can cause significant impairment in either social functioning or school functioning.
I will point out that the American Academy of Pediatrics does recommend that pediatricians evaluate children for ADHD starting at age 4 and up if these symptoms are really causing that dysfunction that you described. So I want to kind of set the tone that as we're talking today, we're going to focus on those younger age groups. And then this will be our launching point to talk about the ADHD and all of the questions that come up.
So today we are going to start with a personal story. And again, Vivian, you have the honors of sharing with us today.
As you said, Sylvia, I have experience as a mom with children with ADHD and as a physician diagnosing children with ADHD. And I want to say a few things to start off. First of all children with ADHD are different. So there is no story I can tell that will feel universally applicable. And also, any story I could tell about children with ADHD could happen to a child without ADHD, right? It's so much more about the frequency, the age at which it's happening, the longevity at which these things are still happening, how old they're getting, and the difficulty in changing the behavior. And I also want to start by saying right off the bat, okay, here is what I love about my children with ADHD. First off, especially when they were younger, we would meet so many people because everywhere we would go, the playground, the library, the grocery store, they would talk to people all the time. They were constantly finding friends when we were at the pool or whatever. And I love that about them. I feel like they've opened up my world to people that I would never talk to, right? Like they're so less inhibited to talk to strangers in that context. And that's been really fun. So I just want to tell you a quick funny story. This is one of our absolute favorites. It's legendary in our house. So my child with ADHD is fiddling with my husband's Apple Watch, and he somehow ends up texting our handyman. And he texts the handyman, "I love you as a friend." And what makes this story even better is that Eric didn't realize that this had happened for about 5 hours. He realizes that he sent this text to our handyman, who is a dad with 4 kids, who we see once or twice a year and is a very, very nice guy. And the text is almost believable, right? It's right on the line of awkward, believable. This adult man could get that and be like, thanks. He's appreciating my work, I guess. And my child is not a toddler at this point. He's older. And Eric explains to this very nice man, I have a child with ADHD. This is just the kind of thing that happens. Really, I do really appreciate you. I do really like you. I really appreciate your work. But that text was a little out of character for me. So I think the point is that often parents who have children with ADHD, as their brain is impulsively and rapidly and hyperactively processing the world, there's just this outfall of that for the person who's a little more introverted and quiet or a little bit more orderly needs to adjust because things just that entropy is escalated. Things get fidgeted with or played with like the Apple Watch, where there wasn't necessarily a thought of, wait, maybe I shouldn't be playing with dad's Apple Watch. Thank goodness he didn't lose it. That's usually the fallout of what happens after this. Things get dropped in the toilet. Things get taken from other people's rooms. And I think what's different in the child with ADHD, you said this in the definition, it needs to be more than 6 months. Again, any one of these things could happen to a child without ADHD, but it's not as easy as sitting the child down and saying, hey, you shouldn't touch that or you shouldn't do this.
Mhm.
Because the next 20 times that the idea pops into their head, they don't remember that they're not supposed to do that. And it can
Right.
be years of training and reminding. Similarly, hey, could you not take the buttons off of the remote? Because then nobody can watch TV, including yourself. Oh, but I wasn't thinking about that when I was holding the remote and I wanted to know how it works. So I took it all apart. This
Right.
happens all the time. And I think that's where the frustration can come in for families with kids with ADHD, as well as there's a little bit of a fear in parents of, well, can I send this child to somebody else's house for a play date? What if they do these things at their house? Or will the
Right.
other person understand that they're not trying to be defiant or malicious, or this is just their brain operating on this different level of excitement and enthusiasm to explore this world around them without thinking through the consequences or necessarily remembering the structure and the rules. So with the story I told, my child wasn't trying to do this thing that was funny. In fact, when asked about it, I don't even think he could figure out how to do it again. It was this fidgeting and playing with the watch and creatively clicking on all these buttons that somehow resulted in this outcome.
Yeah. Now might be a good time to talk about the parent perspective, where in your story, I heard the potential of your child taking apart the remote, your child losing their father's Apple Watch. You get frustrated with a child, you get angry at them. If the child is doing this a lot, then they can feel like their parents are angry with them all the time.
Right.
I'm getting in trouble all the time. Or if this happens in preschool or at school, the teacher's getting angry with me all the time. That's kind of like how the child may perceive the adults around them. Secondly, we talked about in our pilot about parents under pressure. If you feel like you can't connect with other families or other parents of your children's friends because you're worried that your child is going to quote unquote misbehave at their house, then that can be very isolating for parents too when they're trying to find connections with other adults in the community.
Yes, yes.
Just to kind of empathize with how difficult it is to be a parent of a child with ADHD, because it's not just, haha, one funny story. This is every day, and
Yeah.
it can get very frustrating and tedious.
I think we should talk a little bit about what does it look like for a child to be exhibiting these symptoms at these young ages to the extent that you would consider discussing with your pediatrician the diagnosis.
Sure. Maybe give some examples of what it's like when children have trouble curbing their high activity level. What is your experience with that?
Yeah, the classic thing people refer to is, well, they can't sit still, right? And I want to make a point here because at these ages, it's very normal for children to be very, very active. Anybody who has toddlers knows that as soon as they start walking, they run from point A to point B. Like, that's what they do. They run everywhere. And if you can imagine a toddler, a 4-year-old, let's say, they're running around the house, they're active, they're playing, they're outside, they're running. But there comes some point during the day where they want you to read them a story and they get up in your lap and they relax into you and they sit there. Maybe it's even watching TV. And I think of that child that at these young ages is struggling so much, it's almost like they are not even capable of ever doing that. They just can't physically do it. They think they want to read the book and then they get up, but then they're so agitated and they're moving around, they're up and they're down, they're up and they're down, and it's almost like their skin is crawling. They can't physically do it. It's different.
Yeah. And also sometimes the impulse control can be seen. Maybe you can give some examples of how that may present.
Yeah, I think with my story about the Apple Watch, like I said, things like this could happen with any child. But for many children, it's as simple as saying, okay, the Apple Watch is off limits. It has to be in the charger. You're not allowed to touch it. But with your ADHD child who's making these decisions so impulsively, you realize that's just not as easy as that. This is going to be a very long process of reminding the rules over and over again so that at some point, when you're impulsively going to touch something or take something apart or take something that's not yours, suddenly there's a bell that's ringing of like, oh, wait, I'm not supposed to do that. But it's
Mhm.
not going to happen on the first try.
Yeah.
So I think oftentimes the impulsivity can be mistaken as defiance
Mm.
because you are not following the rules, but there's a major component of you just aren't processing the rules in the moment that you see that shiny object and are so excited, whether it's in the classroom or at home, to take it and touch it and take it apart or whatever it is.
And then the last characteristic is the sustaining attention. So, when do you think parents should be alerted that my kid isn't really paying attention enough?
That's a trickier one. And as you and I both know, the inattention part of ADHD is much harder and often goes to undiagnosed until much later in childhood because it doesn't disrupt the classroom setting. It doesn't necessarily cause some disruption at home, but maybe it's along the lines of they're just not showing school readiness. Like there are developmental milestones that are being missed. And there's a part of that where they just can't attend to what's going on around them to process that information and learn. It's even then at those young ages starting to inhibit some of
Mhm.
that development, some of that learning. And I feel like an important part, especially when we're talking about these young ages, 4, 5, 6, early elementary, late preschool, an important part to considering the ADHD diagnosis is this somehow interfering so much that they feel like they are failing, whether it's socially, academically, behaviorally, whatever it is. We don't want to put them in a cycle where they continually feel like a failure.
So, let's move on to recommendations on how to diagnose and how to treat ADHD with the assistance of your pediatrician. So, Vivian, let's start off with when you think parents should approach the pediatrician if they're concerned that their child might have ADHD.
So, again, going back to the guidelines for when to evaluate, when I see a child in this young age range, 4, 5, 6, who is in a pattern where they are failing, or it seems like they're failing, constantly getting in trouble at school, or just constantly irritating everybody at home, in the context of these types of symptoms, this impulsivity, the hyperactivity, there can be such a temptation to label that as defiance, quote unquote, bad kid. And so let's say I see a family like that and I'm like, okay, let's schedule an appointment for where we're just focused on discussing, ADHD as a possibility. Then take it from there, Sylvia. What are you going to do when they come back for that appointment?
Sure. So in our office, we do our initial ADHD evaluation appointment with the parents only. And oftentimes it's to just listen and hear the parents out with that without them feeling like they need to hold back in front of their child or maybe reveal their true emotions and feelings about how frustrating it can be. ADHD is a clinical diagnosis. It's not a medical diagnosis where you can do a blood test or order an x ray or a CT scan to diagnose ADHD. So, because there are clinical criteria that need to be met to have the diagnosis of ADHD, there are surveys, which we use the Vanderbilt survey. There is one where the parent reports how the child is in the home setting. And then I give them copies of a teacher version of that where they distribute it to as many teachers as they have in the school to give their feedback on how the child is behaving at school. At the end of the initial visit, I often will spend a little bit of time trying to reassure the parents that there are certain characteristics that ADHD children have that can be good, like you were describing at the beginning of your story. Your children are more social, they're less inhibited talking to strangers, and they make friends. To try to give parents a little bit of perspective of this is not necessarily always a bad thing, and to maybe accept the diagnosis with the pros and the cons with it. And then afterwards, we do a second visit where the child comes in with the parent. And hopefully the Vanderbilt forms are complete and we review the forms together. So I will spend a little bit of time, depending on how old the child is, asking the child, why do you think you're here? Sometimes they say, because I get in trouble all the time,
Mm.
or the teacher's mad at me all the time. Or sometimes they're like, I don't really know. And it's funny because oftentimes, which isn't part of the diagnostic criteria, but one we see in the office is that that a child probably has ADHD when they're sitting on the examination table and the paper is shredded. Like they are constantly fidgeting, picking, ripping, and the whole paper is like a box of confetti at the end of the visit. So, why don't you highlight for us a little bit about what options parents have for treating ADHD after the diagnosis is made?
Okay. Well, again, this episode we're really focused on these younger age groups. So one of the first recommendations is behavioral therapy, which is focused on helping the parents understand the diagnosis and modifications they can do in their home to help. One of my mantras in life is that if you have low expectations, you're never disappointed.
Right.
We need to adjust our expectations as parents. Does my house need to be neat all the time? Does it have to be orderly? Do your clothes have to be put away a certain way instead of like scattered all over the floor? I need to change my expectations for what this child is capable of and gives them a sense of independence without making them comply with, what I would like, right? And then for that school age child, I talked to the parents about taking, my letter with the diagnosis to the school and requesting evaluation for a 504. Will their child qualify for a 504, which triggers a meeting with the parents and the teachers and the parties involved to discuss accommodations they can make in the classroom, not special education, not pulling the child for any different curriculum, but in the classroom to try to help this child be more successful.
Can you give some examples of what types of classroom modifications people can have with the diagnosis of ADHD in a 504 plan?
Yeah, so again, this is a discussion that the parent and the teacher together have. There's a lot of latitude to tailor this specific to the child. So it can be extra time for tests or homework. It can be more frequent breaks between tasks. For the younger ages, it might be more frequent bathroom breaks if that's an issue for them and remembering to go to the bathroom. It can be things like helping them with organization, like having a notebook or a planner, or knowing that that child is going to approach the teacher each day with their backpack before they go home to make sure that they have everything they need. There's a pretty long supply of things that can be implemented, and creative things that can be implemented in a 504 to help the child. And I also think the benefit of this is that ideally we want as many adults advocating for this child as possible.
Right. I couldn't agree more. After the diagnosis of ADHD is made, we often approach treatment in a stepwise fashion. Maybe some behavioral therapy, maybe some school accommodations through a 504 plan. And then there's not necessarily they must be on medicine, right? You
Or
can
yes,
do it step by step. Let's try this first and then we'll follow up, see how things have improved, or maybe we still have a problem and then we'll explore the next intervention. So, when you get the diagnosis of ADHD, you're not obligating your child to be on stimulant medication.
absolutely.
Right.
We might be diagnosing ADHD and then seeing their trajectory, maybe with a little bit of maturity and a little bit of developmental gains, that these issues related to ADHD become less and less of a problem for that child. On the flip side, when we see a child whose trajectory is demonstrating that they're falling further and further behind or having more and more difficulty with their ADHD symptoms, then down the line, that might be a child where we have a discussion of what else can we do to help them. As well, with any child where we're considering the diagnosis of ADHD or the diagnosis has been made, we do need to have a discussion about diet and sleep. As you can imagine, if you have ADHD, that may be affecting your sleep. If you're not sleeping well, that may be exacerbating your symptoms. So, all of these things also go hand in hand. And that should be another topic at some point where we really talk about diet and sleep habits and what we can do to encourage this child in their diet and sleep habits to set them up for success behaviorally as well.
I also feel like sometimes there can be a negative stigma associated with an ADHD diagnosis. Parents sometimes avoid the diagnosis because they don't want their child, quote unquote,
Yeah.
branded
Yes.
with the diagnosis. And I think in this podcast, we're outlining how the diagnosis can be helpful. So parents understand their child, teachers understand their child, and the child understands themselves maybe a little bit better. And then there's an acceptance of the way that their child is and a cooperative effort towards improvement, as opposed to what you mentioned, that constant feeling like they're being punished or they're in trouble all the time or they're making adults angry
Right.
all the
Right.
time. And that it can eventually undermine their learning, their ability to socialize with other children at school
Yes.
because
Yes.
they are branded as the quote unquote troublemaker at
Yeah.
school, and then ultimately affect their self-esteem.
Yeah.
So, I hopefully we've dispelled the stigma of having the ADHD diagnosis. This has been a really great introduction to attention deficit hyperactivity disorder and what it may look like in a younger child and what interventions can be done to diagnose and help on the way of treatment. Why don't we end with some summary points?
Okay. First, as we said, we have so much more to talk about. We hope to get there. Second, your pediatrician is a resource for you. And as the AAP has stated in their guidelines to us as pediatricians, we should start thinking about this in these early ages, 4, 5, and 6, if we have a child who is exhibiting these symptoms of ADHD and it is causing disruption or failure academically or behaviorally over periods of time consistently, not just once in a while, because that can happen with any child, but consistently, this is an issue. And then for that child who is diagnosed with ADHD, we want to set them up to prevent them from being in that cycle of feeling like they're failing and provide resources to help parents and teachers to be advocates for this child. And finally, we talked about this to allow parents the freedom to embrace the uniqueness and joys of having a child with ADHD.
I just wanted to preview some other related topics that we would love to highlight in future episodes. More details about behavioral therapy and what that is. Talking about the preteen entering middle school and what ADHD may look like there. Oftentimes, the words executive functioning come into play. What is that? Where is there dysfunction in that? And how can that be helped? ADHD in the teenager, the high school student, what that looks like, how management can change. And lastly, medication. What are the medication options? What are their side effects? And how is it decided that medicine is started and which medicine is tried?
Sounds good. This has been a good chat.
So this is 10 Kids, 2 Docs. I'm Sylvia.
And I'm Vivian. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.